Part 3 Blood pressure. Ranges. The National Institutes of Health cite normal blood pressure to be below 120 mm Hg systolic and 80 mm Hg diastolic. However, blood pressure changes naturally, a fact that cardiologists explored while writing about blood pressure variability in Nature in March 2013. Blood pressure is characterized by marked short-term fluctuations occurring within a 24-hour period, beat to beat, minute to minute, hour to hour, and day to night changes, and also by long-term fluctuations occurring over more prolonged periods of time, days, weeks, months, seasons, and even years. The guidelines state that for blood pressures above a figure of 115/75 of a millimeter Hg, every rise of 20/10 of a millimeter Hg doubles the risk of cardiovascular disease. The overall guidelines for high blood pressure received an update in November 2017. They allow for earlier intervention. Since 2017, the American Heart Association (AHA) has advised that people with high blood pressure should receive treatment at 130/80 of a millimeter Hg rather than 140/90 of a millimeter Hg. They also removed the prehypertension category between 120/139/80 - 89 mm Hg. A blood pressure reading of 140/90 of a millimeter Hg now qualifies as stage 2 hypertension and not stage 1, as it used to be. This category now forms two separate ranges: elevated blood pressure, from 120 to 129, less than 80 mm Hg stage 1 hypertension, from 130/139/80 - 89 mm Hg. In these new guidelines, the AHA also advises that doctors should only prescribe medication in cases of a previous heart attack or stroke, or in the presence of risk factors for these conditions, such as age, a diabetes mellitus diagnosis, or chronic kidney disease. Treatment at the earlier stages should instead come mainly through lifestyle changes. Tips. The guidelines for doctors list the following measures patients can take to help keep a healthy blood pressure, keep a healthy body weight. Eat a diet rich in fruits, vegetables, and low-fat dairy products. Cut down on sodium or salt in the diet. Take regular aerobic exercise, such as brisk walking, for at least 30 minutes a day, most days of the week. Moderate alcohol intake. Men should drink fewer than 2 alcoholic beverages a day for men. Women and men with a lower body weight should consume a maximum of 1 alcohol drink a day. Taking these steps can reduce the risk of health problems further down the line. Discover Way Cure High Blood Pressure Fast. Only 3 exercise simple at home. Click on the link in the description.